My name is Dr. Deanna Attai. I'm a breast surgeon. I'm an assistant clinical professor of surgery at the David Geffen School of Medicine at UCLA.
What does it mean to you to be a strong woman?
Yeah, it's funny because I don't necessarily think of myself as strong. As I'm going about my day, I don't consider myself strong or a leader. I'm doing what I do. It makes me really proud when people say that. It makes me feel like, yeah, I did good. The typical surgical personality is you identify a problem, you go fix it, and then you move on. So when I was in my first practice in DC, I often heard the comment, "What are you doing in there talking for so long?" I was in the room with my patients for longer than my partners. So on some level, I think I began to realize that I was doing something a little bit differently. I liked the longer term relationships. It seemed to resonate with my patients, and that's how my practice just gradually evolved. Oh, you girls. Oh. At night, it's the Kitty 500. So normally the little fluffy one would actually be coming up and climbing up here and sitting in my lap.
Tell me a little bit about your Twitter chats and how that got started.
What I found on Twitter is there were a lot of patients, women, talking about their breast cancer experience, and it was like an online support group. And I stumbled on a conversation that two women were having, and I just watched a little horrified for a few minutes that these women had to go to Twitter, of all places, to try and sort this out. So I butted into the conversation a little bit and just said, I'm a breast surgeon, this is something that I treat. And that was my aha moment. Because before that time, I was struggling a little bit as a physician in a patient space with what my role was. And at that point, I realized my role is to help correct misconceptions and help provide information and education and guidance. A little bit after that, the weekly chats started. They were started by two breast cancer survivors, and so I've been involved in the chats ever since. This is like the unfiltered view. You know, when the patient goes home, changes into her pajamas and sits down and is talking with her friends or her family, this is the view that we see. And they're looking for answers. The patients are overwhelmed and they don't hear everything that's being discussed in the office, because patients come into the physician's office oftentimes on their best behavior, if you will. They know they have a limited time with their physicians. This is the tumor right here. Potential side effects from treatment, quality of life issues sometimes get glossed over. And what we've all realized, all of the physicians who participate online, we need to do a better job asking our questions, because we're missing important pieces of the survivorship puzzle, definitely. There's no shortage of misinformation and false information, and we need to meet our patients where they are, and our patients are increasingly online. It's really part of our responsibility to make sure the information that they're finding is accurate. There needs to be more of us out there than there are. So let's look at the OR schedule. Okay. All along when I started expressing an interest in medicine, all I ever heard was, it's a very difficult field, it's a very difficult field. Surgery is known for being a very demanding specialty, both physically and emotionally. But I remember going on medical school interviews and being asked what were my plans for family, how would I manage being a woman in medicine. And I just remember thinking at the time, what difference does it make if I want a family? It's almost like we're being discouraged right from the start. To be asked at that young age, that's really unfair. The one interview that still stands out was sitting across from what was probably a department chairman at a university hospital. His statement was, Women aren't always accepted in the operating room in this institution. How would you handle that? That was his question to me. I still remember sitting there wondering, why are you asking these questions? Why aren't you fixing the problems in your institution? And unfortunately, we're 20 plus years later, and those problems still exist. There's no question that I've had to struggle a little bit more to get my fair share of operating room time and things like that. There have been a few instances along the way of what I would say is, yes, overt sexual harassment and discrimination. That for the most part I've handled by just pulling back and disassociating from the harassers. I can't encourage somebody else to do that approach. Because especially with so much that's going on nowadays just in our country and the world, we can't just sit by and be silent about it anymore. If we have the ability to make a difference, we need to do that. With age comes a certain responsibility to say, all right, I want to try and make it better for the next generation. Some of the ones coming up now are still being exposed to that kind of harassment and discrimination, and it just needs to stop. It just needs to stop. This and all of this is all cilantro. I actually started when I was going through a period of not so great health. I felt like I needed to grow things. And moving into this house in a lot of ways, I think, honestly, in some ways saved my life. It feeds me in a lot of different ways. There's a certain strength that physicians need to avoid being burnt out. Physicians, and especially oncology physicians, have a high suicide rate. You know, you go to medical school, you go to residency, and especially surgery, I mean, we were just expected to just go, go, go. If we had focused on self-care and physician well-being, I'm absolutely convinced I wouldn't have the health issues to the degree that I have. Did you get my artichoke? The bees love them when they flower. You do need a certain emotional strength to be a physician, especially in oncology. To be able to switch from the clinical to the emotional and have them coexist in the same day, in the same minute even. Otherwise, you just can't survive. I see how I'm considered a strong woman. I'm a surgeon, I'm taking care of cancer patients, I'm a past president of a national organization. Part of me being a very quiet personality, that doesn't really mesh with being a surgeon. At work, I am a certain person, but I draw strength from my patients, from my staff, from my garden, from my little kitties. If I'm sitting in a meeting and there's just all this stuff flying, my little Zen bubble goes up and I will just kind of sit there and find something to focus on that is not in that room. I don't wear a strong woman hat. I'm just doing what I do. I can use that platform to at least say to somebody that's maybe interested in medicine or interested in surgery or someone that's just starting their career and be a resource. We can help empower younger women in ways that we never could have before. Because there's no reason you can't do whatever you want to do.